Bore da croeso, good morning and welcome to today's board meeting, public board meeting, the first one of 2023, which I know is going to be a year which is going to bring its challenges, but also a year in which I'm very much hoping we're going to be making significant progress in some key areas of our work, one of which we're going to hear a little bit about later. As is usual, our usual approach, this today's meeting is being held virtually through Zoom. The meeting will be recorded and people will have an opportunity to listen to the recording via a link on our website. Simultaneous translation facilities are available, and for those people watching today's meeting who aren't familiar with how to access that, if you hover your cursor over the screen, you will see a little globe at the bottom. I think it's usually the third in from the right on the icons. If you click on that and select Hear Translation, if you wish to hear the translation of anyone speaking in Welsh this morning, and if you leave it on that channel, you'll get both the English feed and the translation feed. Board members, as is often the case, working virtually, might not necessarily be looking at the screen. We apologize for that. We'll be looking at our papers. We will be taking a break during the morning, and we're scheduled to finish the board meeting today at around about 1:25. As you're aware, board members, hopefully if you had anything on the consent agenda, you've already brought that to the attention of Chris. I'm not aware of anything, so do mention it when we get to that point in the meeting. It gives me great pleasure to welcome our final appointed executive director to today's board meeting, his first board meeting. I think you've been with us about a fortnight now, Sam Lloyd. It does present me with a challenge of having two Sams on the board, but I hopefully you'll bear with me if I call the wrong Sam at the wrong time. Sam, I don't know if you'd like to say a few words by way of introduction.
Thank you, Simon. Morning, everyone. I'm very pleased to be here. I'm currently 9 days in, so learning a lot about the organisation, but it's clear to me already that we've got some great people and a really important mission. So I'm very excited to be here and to be part of it. Thank you.
Great, and we're looking forward to working. You've been part of the DHCW team, Sam, so welcome. And also welcome, you can't see them at the moment, to Matt Cornish and Joanne Dundon from the DSPP programme, which we're going to hear about in a little while. Apologies for absence. For apologies from Marilyn Bryan-Jones, who had a prior commitment. She's hoping to be able to join us through the morning, and I know that Alistair may have to leave us at short notice due to a family commitment. So Alistair, please feel free to do so if necessary. Declarations of interest. None have been communicated to me prior to the meeting. Just quick ask if anything has occurred to anyone since receiving the papers. No, thank you very much indeed. If I move on then to the consent agenda, as I said, nothing has been indicated to us, and I don't think it looks like there's anything anyone wants to raise. Okay, there's a minor correction. It's a minor correction to the minutes, but a major correction to public policy. In the minutes it mentions the confirmation that national insurance would be funded by the government, but as the Westminster government have now removed the national insurance hike, obviously we won't be getting cover for that hike from the government. So that has been amended to reflect the actual position as it stands now. If I move then on to the items we've been asked to approve and note, people happy to approve the minutes from the board meeting held on the 24th of November, subject to that minor change I mentioned. Thank you. If we happy to note the action log, noting that there's 1 action is underway and 10 are complete. Thank you. And then noting the forward work plan and the COVID-19 inquiry update and the end of year reporting arrangements for 22-23. People happy to note all of those. Thank you all very much. So then, as I mentioned briefly earlier on, if we move on to the shared listening and learning presentation, which I'll invite Ridian Hurl, the Executive Medical Director, to tell us what that is about and to introduce Matt and Joe Dundon to to the meeting today. So over to you, Rydian.
Thank you very much, Chair. Good morning, everyone, and Happy New Year. It's a great pleasure to invite Matt and Joe, and shout out to all the other colleagues who've been involved in this programme. Navigating healthcare systems and services is complex. It's complex for those who work within the healthcare. So knowing what is happening can often be very difficult, and it can be frustrating. This programme aims to make it easier for patients and the public to access services that can provide them benefits. And these services are often focused on improving disease self-management, improving independence, signposting to prevention, and empowering patients' choice. And I think you'll enjoy this presentation, and I look forward to questions at the end.
Good morning, everybody. My name is Matt Cornish. I'm the Co-Programme Director for Digital Services for Patients and the Public programme. Joe and I will be jointly presenting and answering questions. This programme comes to at a really, really important time, so we're delighted with this opportunity to be able to show you what we've been doing in terms of the development of the NHS Wales app and bringing it into the hands of real people to be able to look at it, assess its use, and provide us with feedback, which is important to us so that we get the deployment right. So if you go on to the next slide, please, Hannah. Very brief agenda. We're going to set out a bit of an introduction to the programme itself in terms of what it's aiming to do. Then a demonstration of the NHS Wales app so you can see what we've done, how it looks, how it feels, and then our future plan ahead. I'll then take a little bit of time to walk through what we've done already, that private beta, that approach, and the learning that we've done in terms of working with real people. And then how we're taking that learning into our broader adoption approach into our public beta. And then we'll be very happy to take any questions which you may have. So next slide, please. Okay, at the top of the slide, DSPP, Digital Services for Patients and the Public. And you'll see our maxim, joining the dots with digital services. We see ourselves as a key enabler, an enabler which was envisioned number of years ago, but envisioned and supported by Welsh Government to help us to deliver better joined up care, to help it ease pressure on health services, and I think we'll all understand that at this particular time, but also to help health providers to join up care and ultimately to be there providing benefit to citizens. Now we are about the NHS Wales app, and that's probably the part which is most above the surface. But below that, we're very much interested in the standards by which other services will integrate together so that through one particular resource, the patient or the citizen can engage and can take a more active part in the way that they manage their whole health and care. Now, as has been described, the programme was set up in March 2020, but it really gathered pace at the end of 2021, when we brought on board a delivery partner which had worked in England on their particular app, and then looked to build it in less than 11 months. So a really, really accelerated programme of development, which we then took into the hands of the public. The programme involves a team, a core team within DHCW, but also from partners from across the health and care landscape in Wales, so from every health board and trust, and also from social care, working collaboratively together to make this programme and the delivery of the NHS Wales app everything that we want it to be for citizens. We did take the NHS Wales app into that private beta starting in October. And a little bit later on in the presentation, I'll bring that feedback very much to the fore. So if I now ask Hannah just to play the demonstration of the video, this will be really, really important because it really set out what we've done and give you a real rich illustration of how the NHS Wales app looks, how it feels, and the potential that it can provide. So over to you, Hannah.
The NHS Wales application's first release, private beta phase, will be to a pre-selected group of approximately 1,000 users in 10 practices across Wales. This testing phase will enable us to capture real feedback from users within a production environment, and we can use this data to further refine the app before we roll out to a wider audience in Wales, known as public beta. Account authentication and verification will be possible with the NHS login. Users will be able to use their smart device capabilities such as fingerprint and facial recognition to access their app. For users who do not have access to such devices, a website version is available, allowing access through a similar, password-protected and safe process. The NHS Wales app has been styled and branded in accordance with the NHS Wales brand toolkit, and also meets the strict accessibility standards and will be accessible to audiences who are visually impaired. We have worked with user design and content experts in partnership with members of the public to create the content provided through the app. We've also worked with qualified and approved Welsh language experts to ensure the content is clear and correct in Welsh. Users will be able to access the app on their smart devices or website in their individual language preference. The first of our live integrations with services already accessible by the public in Wales allow users to easily navigate to the 111 service to get help with their symptoms, find local services and access health tips. Users will be able to access the 111 service content in their preferred language as set by their NHS Wales app, English or Welsh. As you can see, the service now displays in English, picking up the preference from the NHS Wales app. Users can book GP appointments as enabled by their GP practice. Users can request prescriptions from their GP as enabled by their GP practice. Users can view their medical records online as enabled by their GP practice. Another integrated service where users can also update their donation preferences. And finally, a range of articles have been created to support users who may need more help or want further information. Throughout the private beta phase, we will be engaging with end users and GP practices to identify any further resources which may help them. New functionality which has been built and will be coming in future releases includes the About Me data. The timeline, a chronological view of users' health events, and a journal to help capture their own entries. The ability to rebook a vaccine appointment, and the ability to update their demographic data held by the GP system. And this is just the beginning. We have a growing roadmap of new functionality to explore and build to bring further value to the citizens of Wales.
I'll just let the music play down. Hannah will now bring us back to the presentation. And I want to talk next about the experience in private beta, because I think that'll add a lot of real richness in terms of what we've done. So on to the next slide, please, Hannah, or a couple of slides through. Wonderful. Right, this slide is really important to us because we wanted in our private beta to involve real practices who wanted to work with us. And so what we sought to do was to be able to collaborate with 10 practices spread across Wales but were interested in exploring the private beta with us. Now, all of these practices were supported by a particular system supplier, system called Segedim. Reason for that was that that system was available to work with us at the time. We were waiting for the second system supplier to come on board, but the learning which we've got from these practices is transferable across all 379 practices in Wales. So 10 practices, a number of important characteristics of those practices, some very urban, some very rural, every health board area in Wales involved, but sharing a lot of similarities in terms of their willingness to be part. If we go on to the next slide, please, Hannah. It was also important to us, as well as identifying practices, to identifying a cohort of citizens to work with who were as representative of the 3.1 million people in Wales as we possibly could find. And so we worked with practices to set in some important conditions in terms of age, in terms of gender, in terms of ethnicity, in terms of familiarity with information technology, in terms of whether they were a carer or needed support. We sought to make it as broad as we could and gain feedback from important representatives on our patients and public assurance group to show that sort of 1,000 citizens that we invited to be part of our private beta would truly be as representative of the population as they could be. If we go on to the next slide, please. And the next slides really reflects what we did, starting on the 17th of October and then completing the active phase in early December. What we sought to do was to invite our selected participants to carry out some set tasks for us over the course of that period. And that started off quite simply in terms of switching language or accessing the NHS Wales app via biometrics. And when I'm talking about the NHS Wales app, I'm also talking about the website because we dealt with both exactly in the same way. Over the course of the period, we were able to onboard 706 registered users. We did dive into reasons for why people hadn't chosen to take up that survey, and largely it was because of time factors which didn't allow them to commit. What that meant was that across each of our 10 practices, we had a minimum of 63 and a maximum of 80 citizens participating, which we felt was a really, really good spread. And over the course of the beta period, we also asked them to carry out other set tasks in terms of ordering repeat prescriptions, if they were due to do, to be able to look at their medical record views, and also to be able to book appointments if they were made available, and then be able to show that the technology works and to cancel appointments. We also asked for lots of feedback. Not initially in the first week, we just wanted feedback in terms of whether there was an issue, but we thought that there was a chance that we'd be skewed in our views of just focusing on issues. So we asked for satisfaction feedback after each of those respective tasks, and satisfaction feedback to come back to us in both English or in Welsh, whatever was the user's preference. And over the course of that period, we analysed every piece of feedback and then we put it into themes. And so the next slide, which I'm going to describe to you, sets out the key themes of feedback which we described, as well as key bubble feedback, in a sense, of what people were saying to us, which I think will be really, really informative. So if we go to the next slide, please, Hannah. Oh, sorry, slide after. So user satisfaction. Over the course of our beta period, our satisfaction graph remained pretty consistent in terms of, around the half to 70% of people either somewhat satisfied or very satisfied with their experience. As we weren't down the continuum, we did try to understand why people were not satisfied. Was it to do with their experience and the interface of the NHS Wales app? Or was it more to do with actually the services being provided, which we have a lot less control over? Whether, for example, a GP practice chooses to turn on appointment booking or the content of their medical record. And so I think that's the part which I'll bridge on to the next slide. So next slide, please, Hannah. Okay, so this is the real action slide in the nicer sense of this presentation. So what we found from engaging with users is that they found it easy to be able to log on. They found the biometrics easy in terms of changing those. They found it easy to jump off to the 111 service and access that, and found that a really useful addition. They also found it easy to be able to look at the organ donor service and bloods, similar to the 111. There's a couple of points which I want to draw out. So we did find in the nature of private beta, but there was a fingerprint issue. So an issue with users being able to access the NHS Wales app through a particular type of Android device, which were thanks to joint work between our colleagues in Kanos, who are our delivery partner, and colleagues in Cegedim, we were able to triangulate what the issue was to be able to put in a fix, be able to show that the fix had worked, and then go back to the users and then confirm that it was working for them. So that's why that issue is flagged as green, as opposed to what you'd normally think of as red. When appointments were available, we found that users, it was easy to book appointments and to cancel. The areas that red, which are towards the top of the slide, really reflect what we probably expected, i.e. that if an appointment wasn't enabled, then the user wouldn't be able to book the appointment. And so they provided us with objective feedback, but to some extent, there was some disappointment in that. And I think if you look at the bottom right of the slide, there's a user feedback in terms of the challenge of appointment booking and wanting appointment booking for that, but that appointment booking not being made available within the GP practice. Now, our approach has always been to work in collaboration with GP practices and to be able to show where appointments are going to be able to add value, and so that people can understand the benefits of that and then to support broader adoption. We definitely don't come with any sort of stick. We're very much focused on reducing the costs of any adoption and it helping to be able to deliver improvements which are going to benefit people. Other feedback on this certainly reflects the ease of being able to be able to make repeat prescriptions, certainly in comparison to the existing system via My Health Online, which was really pleasing for us. And so a lot of this feedback actually really emphasize the value of the iterative staged approach to testing, so that we can ensure that the services we offer meet the needs of end users and also meet the needs of those service users who need to in turn support citizens. So next slide, please. The plan for public beta, and this is important. We recognised that just going to a big bang, making the NHS Wales app available to all practices at the same time, presented significant risk for them at a time when they're exceptionally busy meeting current demand. And so what we thought we needed to do was to work with a limited controlled group of practices, as we had done in private beta, to be able to explore learning, to understand what would need to be in place to support a broader rollout. Again, focused on vision supported practices initially, including those 10 private beta practices, which I flashed up on an earlier slide, and including other practices who we've assessed as being really well prepared and ready to support adoption. So we've got another 10 geared up, ready to start. We also need to work with the EMIS supported practices, and we've got a plan to be able to do that when an important interface is in place. And so that will help us to support adoption across all of Wales, which is really, really important to us. The next kind of line below, in terms of expanding the number of users in a controlled way, is very important. Now, because of the feedback which we received about users being able to easily manage repeat prescriptions and the like, it makes sense to use those people who are familiar using that My Health Online functionality, which is directly related. And so we've got an approach which would seamlessly introduce people towards the NHS Wales app. We'd also look to specific practice promotion activity to bring other people on board as they're able. And then later on, once we've got sufficient spread and we've done a lot of learning across Wales in terms of the adoption, we then look to gear up the national campaign to encourage adoption by citizens all over Wales. But I would add the first two steps are really important to us, so we can manage those and ensure that what we do deliver to all citizens is what they would want. And of course, the DSPP engagement team would also carry out activities to support practices and to support citizens. And I'll talk a little bit more about that below. We are developing features all of the time, and the functionality available in the NHS app will continue to mature and will continue to improve. And there'll be no end point to that. So that's also important to us. In terms of the support we're providing to practices, well, we've developed a toolkit, which we've took in private beta and have worked with them on its onward development. We're also providing responsive e-learning and training, which would both help practices and provide effectively a surgery for any issues which they encounter, so that they can directly support citizens as well. We're also working with Digital Communities Wales and a whole host of voluntary organisations to be able to provide support in community hubs, so they in turn can provide direct support to citizens who may have issues about connecting in the digital landscape, or not just about the NHS Wales app, but also how they can make the journey and access new channels into the future. So I'll pause there. The last slide is a question slide, and then Joanna and myself will be very happy to receive questions. Thank you.
Thank you, Matt. Just before, while people put their hands up if they wish to come and ask any questions, it might well be worth, particularly for people who are watching, members of the public who are watching, just explaining what vision and EMIS are, because it's not everyone will be aware, Matt, and it is critical to the development of the app and the rollout of the app.
I can. So the practices, GP practices across Wales, are supported by various system suppliers, and there are two in Wales, principally two. One called Vision, one called EMIS. They operate in England as well, but they're important to us in terms of the way that the app interacts with those particular practices. And so we've got to work collaboratively with them in the nature of how we deliver services.
Thanks, Matt. Very clear. David and then Rowan.
Thanks, Simon. Thanks, Matt and Joe, for the presentation. Great to see the progress you've made. Really good start. One of the concerns that got flagged up when you made the presentation to the All Wales Independent Members Digital Network was the take-up of GP practices. And I noticed the feedback. One of the challenges we've got is the availability of appointments. And I know from my own local surgery, which is one of the surgeries participating, they used to make appointments available online, but they stopped that a little while ago. Am I thinking along how do we sort of break the sort of getting GPs to put appointments online? One of the things that occurred to me is if we had some sort of triage service in the app, which actually sort of took you through and maybe pointed you at Choose Pharmacy or actually over-the-counter medication or an appointment with a nurse before you actually got to a GP appointment, the GP practices would be more likely to make things available. So with the link to the 111 service, does that actually take you through some sort of triage process? And could we then sort of close the loop with somebody who's gone through that and does need to see a GP, then the GP practice maybe would be more prepared to make an appointment available?
So really, really good question. Thank you, David. What I would say is that we've recognised that there is a need for a care navigation solution, and you've talked about an e-triage to be able to ensure that the functionality within the NHS Wales app, which is that core booking functionality, is being able to be used effectively, because we recognise that, we're not expecting GPs to just, turn on everything because, they can't, they're fairly constrained. But there are, particular types of appointments which we feel would be more suitable, as you've described, and it might be some particular nurse-led appointments, it might be other appointments. So it's understanding what appointments would best fit. We have some discovery activity which is planned in this space, which will help us inform how we see to take it forward. The challenge, no, it's not a challenge, the opportunity is working collaboratively with those GPs to be able to determine how that could best be implemented. So I think the discovery first, working collaboratively with those GPs and practice managers within that discovery, and then we'll have something which really adds value, because trying to, in a nicer sense, beat somebody on the head to say, no, you must offer appointments is not going to work. And we know that. And the point on 111, we had done some work with 111, we're doing some work on a symptom checker, which would help people to effectively manage their particular care and signpost different providers, healthcare providers, for the type of condition which they've got. So it's something which exists separately, but via the 111 service, which is a core within the NHS Wales app, or a jump off within the NHS Wales app.
Thank you, Matt. At some point we make group questions, but we'll take them individually at the moment. Rowan and then Ruth. You're on mute, Rowan, I'm afraid. First of 23.
Thank you, Matt. Really interesting. And I suppose what I took from that presentation was, I think we've conceived of this as a sort of in business parlance, a business to consumer type relationship. You know, the healthcare provider reaching out to the citizens. But what I heard in that presentation, that there was actually the classic, very important business to consumer relationship. And you gave us feedback about what members of the public thought, but I didn't hear feedback from you about how the GPs felt the app had changed satisfaction behaviours, how it was supporting them. Have we done any feedback on that? And perhaps you could summarise that for me.
I can, and that's a really, really good question. Yes, we have. So immediately after the active phase of our private beta, we engaged with all 10 of our practices to understand the impact on them and the thoughts on their experience. And this, I suppose, supported earlier work which we've done with the practices, which focused on their hopes and fears to see whether those hopes and fears had materialized in any way, and also their feedback on the GP toolkit. And so those practices were able to give us encouraging feedback in terms of their experience. But what I would add, and I should bring Joe in a minute because Joe was closer to this, but of course we were scratching the surface to a degree. As I mentioned, you know, we had 63 to 80 citizens in each of those practices which were involved, you know, not 5,000 or not 6,000 who were involved. And so the impact, you know, was relatively light. I don't know if Joe wants to add anything in on that. Joe.
Sure. Thank you very much, Matt. So, yes, we also ran a survey with the practices, all the practices in Wales, asking would they be interested in taking part in public beta. And so we got a lot of feedback from them. And there's about 57 practices came back saying they would be really interested in taking part in public beta. I think because of the functionality was very similar to My Health Online, they didn't really feel that there were that many issues that were really different from what they were experienced before. And we did in the baseline, as Matt said, ask, you know, how comfortable do you feel answering questions on that the patients might have coming in, and all of them had very high competency for that. So I think as we move into public beta, there'll be probably more questions and more feedback that we can get, which would be really, really great to add to that rich tapestry of info.
Thank you. Ruth and then Marion.
Thank you. Thanks, Matt. Thanks, Joe. You know that we've spoken a lot about the NHS app and DSPP generally. I wonder if you could just speak a bit more about the fact we can't deliver this in isolation, and how does this link in with the wider primary care programme, accelerated cluster development, and other things that are happening in that space in order for us to better be able to access GPs, help them to help us.
Yeah, shall I come in there, Matt? Because obviously there's a relationship with our GP colleagues across Wales through GPC Wales and the networks that we've delivered. Digital Healthcare Wales has recently employed 5 part-time GPs to work both as a regional network and engagement, to work with practices to collect data to engage on the benefits. The big benefit to GP surgeries and to the patients themselves is empowering them to make choices which mean they don't have to go to primary care, to utilise pharmacy services, to utilise high street providers, and to reduce the acute pressure. We need to be cognizant of the reducing number of GPs in Wales. We've now dropped below 400 practices across Wales. They need support in a different way. This is an important tool that we will use gently where they need it to help them deliver the services that they're empowered to deliver.
Thank you, Ridian. Did you want to add anything, Matt, or shall I move on to the next question?
The only thing addition I'd add is, we've been very closely connected with the strategic programme for primary care. We recognise that they have a key role with all of their clusters. And certainly insofar as, you know, keeping them well appraised of our plan, looking to establish closer relationships with them, because, you know, even though our task is smaller than that of England in terms of adopting 6,500 practices, you know, the just under 400 described, it's still significant, and we want to get it right. So we want to work with everybody who can help us in that task, and are working very closely with primary care at all levels.
Thanks, Matt. Marion, and then Alistair, and then Helen.
Thank you, Chair. I'll speak in Welsh if I may. Thank you very much, Matthew, for that presentation. It was really interesting. We've learned an awful lot, I'm sure, about the experiment. You referred to the app in England and the partnership that's existed with those over the border. Can I ask what you've learned from establishing the app in England? And secondly, how many patients do you anticipate will be using this by way of the population of Wales in terms of using this app ultimately? What will success look like for you? And thirdly, with so many of these developments, what we often see is that we have a percentage of the population who are still deprived because of digital poverty. How, and this might be a question for Rydian and Helen possibly, how are we going to be able to ensure that we do not intensify this element of digital poverty, and so ensure that everybody in Wales is going to be able to be in the same position? Thank you.
Thank you very much. I think I caught all three questions, and so I'll deal with them in the order that they were provided. So learning from England, but we learned from England, but we're also learning with colleagues in Scotland as well, who've also got aspirations to develop an app website, similar presence. So the deployment in England, which goes back around 4 years, was to a quite strict political imperative. So a particular date for them to launch their app, big scale across England. Which caused quite a number of challenges, certainly in terms of the adoption on a practice by practice basis, because it was made available to all, and there were, you know, a great number of issues, you know, uncovered from that mass deployment, which took time to be able to address. And the time that it took to address, there was, you know, effectively a damaging of confidence amongst those GP practices. Now, over the course of that first year, they pushed and pushed and pushed, and just about achieved 1 million downloads of their app. But the COVID factor and the requirement to be able to have a COVID pass really caused a mass acceleration in terms of the number of downloads. So they went from just over 1 million to around 30 million downloads in little over a year in the second year. So we've taken a lot of that learning, and we don't want to repeat that. And so when we went to speak to the Minister for Health and Social Services and outlined our broad deployment plan, we wanted to talk about iterative, managed deployments, working collaboratively with people so that we can meet their expectations, as opposed to setting something entirely unrealistic, you know, and then finding that we disappoint along the way. So that's kind of the England experience, and we're very much, you know, engaged in regular conversations with colleagues in England and with Scotland about those experiences. And Scotland are very interested in our learning from private beta and our approach into public beta to benefit from that, and we're very keen to be able to share. In terms of the successes, now this is an interesting one, because, you know, our needs of the services within the NHS Wales app and website will change over the course of our lifetime. So for some of us, we might need the functionality enabled in repeat prescriptions immediately. We might want to be able to access a GP, but for others of us, it might not be of particular interest. We're also developing a whole suite of resources, which will be in a curated store within our app, which will address people's whole range of health and care needs. They might have various jump-offs to those services, which might be of particular interest. And in so being, we've got, in a nicer sense, a tailored services to people, which will change over time. And we're looking very much at the prospect of, you know, enabling proxy access so that we can care and support relatives of whatever age. and also for the NHS Wales app to be there at the very start of our life, right the way through to the very end. So there's a lot which is wrapped into that, and we're not wholly focused on just downloads, because that's not the whole answer. It's the value which people get from within the app and the services connected, which is most important to us.
Thanks, Matt. Alistair, then Helen, and Rowan, you want to come back in?
Thank you, Chair, and thank you, Matt, for what was a really interesting presentation. I was interested, just 2 or 3 questions if I may. I was interested if it would be realistic in context terms to recognise that we're playing catch up in Wales as opposed to taking a lead, as it were, by comparison to other Western European economies. I don't know if that's true, but the context of where we are in that, I'd be interested in. In terms of just some specific questions around the app, very interested in whether we can develop prevention through the use of the app. And the thought is, in the England app, there is a Your Health component on it, as you'll be familiar with, Matt. And I don't think that's fully exploited in England at all. I'm very interested to see whether or not that's something that could be developed and enhanced in Wales for the range of obvious applications, from diet to exercise to, this time of the year, diet obviously plays a big part of people's thinking. And by the time you get to February, they're probably thinking more about Valentine's Day or something than their diet, but how we can use prevention to play a really important part. I was interested in the comments from a couple of the elements of feedback bubbles that you included, which indicated no access to medical records and test results. Don't know if that's simply because of the pilot. In England, you do have access to medical records, test results, and so on. So just clarification on that would be helpful. Also, again, in England, this has proven to be a problem, and the COVID factor you referred to, Matt, is one that, well, we certainly don't want another pandemic to accelerate uptake, but it does create the question, how do we get that uptake? At the point that we really do develop the uptake, I think we're likely to anticipate what they did have in England, which was the age demographic difficulty, which is potentially a real dilemma, that the barrier to access can very often be greatest in the age group who might most need to make use of the app, and how we break through that particular paradox is going to be challenging. The upside of that is that we are probably far more playing into a younger group with the access to the app. And again, that plays us into the prevention agenda. How we can actually make greatest use of that would be very interesting to see. So just 2 or 3 points there, and thank you.
Matt, I think I'll come in there because I just wanted to shorten it to give other people to have an opportunity. First thing to say, Alistair, this is an all-nation approach. What you've seen in England is a disease-specific oriented approach, so ischemic heart disease, diabetes, etc. There's obviously a complexity about what we've learned from the previous implementations of My Health Online. You're quite right about the opportunities. This is a single door into a system, and from that point, you can signpost. So from your medical record, you might be able to identify that an individual smokes, and then you can nudge that person to go quit smoking, or there'll be things for other lifestyle choices. The other opportunity is screening alerts, which is important. Our approach is that this is a trusted source of information, so we need to be careful to make sure that those sources are validated, are approved both by patient representative groups and also by the medical profession. The no access thing, that is a lesson learned, and we're well aware of relating to that. What can GP services provide? What can online pharmacy provide? Directory of services, all of these things need to come into a structured way. I would challenge you on what's available in NHS England, my friend. The media and the publication is often more than perhaps that is on the ground. Barrier to access, we're well aware of the inverse care law. Those that need access often don't. And we will work collectively with the user interface people, the different types of accessibility, access in terms of can you get this on a high street if you don't own a mobile phone? All those sort of things are within the round. So thank you for bringing them up. I'm absolutely confident they're on that work list that Matt has got and started to present.
Brilliant. Can I just very quickly?
Very quickly, because there's three people wanting to come in.
Quickly, it would be worth considering local authorities and social care, adult social care, as a route through to those very people that we want to be able to take it up. Thank you.
That's a good point. Helen.
Okay, Helen, Joe, by the way, oh, you're on mute now. You weren't on mute. You are now. Helen, then Rowan, and then Ivan, and then we better come to a conclusion then.
Thank you, Chair, and thank you, Matt and Joe, for really good presentation and an overview of where we are. A couple of comments from me, and then perhaps something for Matt to expand on. Just picking up the work around GP appointments that David talked about earlier, and the challenges around access to appointments and picking up kind of access to particular services. We are, as Matt said, working really closely with the strategic programme for primary care. There's a lot more that we will be doing in that space, but actually that's about us working with that transformation programme and understanding the service models that are being taken forward, and how then the app and other digital services and information services that we provide actually is going to support that transformation work. So it's very much a partnership approach that we'll take with that. And then on Alistair's point around, no, actually it wasn't Alistair, I forgot, it was Marion, I think, on digital inclusion. I think, again, that's working in partnership with local services and transformation programmes, and as Alistair said, actually local authorities as well, so that we are not broadening the inequality that we have at the moment, so that we are providing equal access, both from a digital perspective, but of course also from an analog perspective, where those services need to be. Hence, actually, from the programme's perspective, actually have an equal kind of focus on the website as well, so that is, you know, more accessible to more. And then my final kind of thing for question for Matt, perhaps to explore. We've talked quite a lot on primary care this morning because that's been the initial focus. I wonder if you could just quickly, just in a nutshell, say where we are with other, you know, the plans for broader interaction with the wider health and care service.
Matt, we'll take Rowan and Ivan, and then you can pick up all those points at the point, any questions raised at the end. Rowan.
I unmuted this time, Chair. Matt, the other thing that I'd just liked for you to surface, perhaps Joanna's got something to say as well, which is, you know, the sort of stage 2 ambition to be able to, you know, prescribe digital services that are specific to the user. It also impacts on our sort of circular economy agenda, in that these could be originally developed by organisations outside of the NHS. For those organisations who are perhaps listening in today, can you talk about the timescales, approach, and sort of those sorts of considerations to enrich what we can offer?
And pick that, Ivan.
Thanks very much, Chair. I just want to make a couple of comments following the questions and comments we've heard from others. Firstly, I'd like to state how quickly this programme has rolled out. It's just over a year since it actually started as a programme, and the achievement in that time is something to be praised, and I'm very grateful to the team. And also the method we are using, which is the private beta, and working intensively with users, taking feedback, and working out in stages how we're going to expand and disseminate use of it. It's quite new to us in terms of providing digital services, and I welcome the commitment, and I'm very grateful to Welsh Government for supporting us in doing this. In terms of comparison with England, We don't have figures as to the cost of the NHS app in England, but I was involved greatly in the NHS COVID-19 app, which is the proximity tracking app. That cost around 45 million a year for development. And you'll see the figures in our app later on in Claire's report, quite considerably lower than that. But the point I'd like to make is there will be many people who will be very excited about what can be done with this app. People will want to have greater and more features. They will want more services through the app. They will want to be able to add things through the app. And we have got to be very careful how much we put on the app for two reasons. One, it will make the app more complicated and the experience will be more complicated for users, and the danger that we will try to do too much, and we have to focus on doing some things very, very well as a priority. And secondly, everything in addition is going to cost more money. And even though we are doing things far more on a tighter budget than we have in England and other places, nonetheless, we don't have a bottomless pit of money, nor Welsh Government. And so we're going to have a very tight focus as to what we can deliver and what we want to provide through the app. But I don't want that to detract away from the work that has been done over the past year. And 2023 is going to be a really exciting year for us with the app and those who use it.
Thank you, Ivan. Matt, and then obviously Joe, if you want to come in with any.
So I'll come back on the first questions, I think from Helen, in terms of what we're doing and who we're working with outside of primary care. And colleagues and people may not know that we've been working for some time with some Pathfinder projects within our local health board partners. So we're working with our local partners in Cardiff and Vale on a patient reported outcome measure project, which we're seeking to integrate with the NHS Wales app, supporting citizens in how they manage and report changes in their condition. We're also working with colleagues from Swansea Bay insofar as a patient portal, which is important to them, which will be connected with the NHS Wales app. And the work with them has showed us how integration would work with other portals and other vendors. We've also been working with our colleagues in Anara and Bevan in a supported self-management project, which again, we're looking to have supporting them to have reach across Wales and for the benefit of that to be accelerated upwards. We're also working with a strategic planned care programme and looking to work in collaboration with them on waiting list information, how we could field that through the NHS Wales app as a first step, but also beyond that, looking at how we can build in self-management resources. So that as well as understanding where each of us as individuals might be on a waiting list, to understand what we can do to proactively manage our health and care whilst we're on that waiting list. So as kind of been referenced before, there's a hell of a lot planned. Our work has been very much focused on building the NHS Wales app and the core that will work. We've got so much possibility in terms of stepping outwards, but we've got to do that collaboratively to make sure that the resources which we've got available are well applied and deliver benefits which are going to count. So that answers that part. The second question I think we received was really about the stage 2, not just about the service users within Wales, but really about those potential vendors who would be very interested in perhaps plugging gaps and coming on board. So we ran a digital services patients and public symposium in November, which was very much focused on where we were with the NHS Wales app at the time and deployment. But we also provided an invitation to suppliers to understand more and to think about how we could work more collaboratively in the future. We've been developing a resource center concept, which the learning of integration will then be able to share, which we hope will reduce the costs of them wanting to work with us, and they'll at least understand the standards that it would take to be adopted into the NHS Wales app. So that's a very current theme of work, because we recognise that we're not going to do this on our own. We need to be working collaboratively to be able to achieve everything that we want to achieve into the future. I don't know if Joe wants to come in on anything on those points.
Yes, thanks, Matt. We've also been collating an alignment catalogue of resources that are used currently in Wales. As you can imagine, there's pockets of good practice across Wales, and actually they're very similar, and there's a lot of duplication. So it's trying to pull that together. We've also been doing some work with Orca to develop an onboarding and accreditation process. So hopefully that will support people wanting to be part of what we're developing. And also, as Matt said, with the resource centre, that's a sort of a place for developers and professionals and the public to be able to find out all about the DSPP and the NHS Wales app. I just wonder if I could just go back quickly on one of the other questions that Marion had raised about digital poverty. One of the bits of work we're also doing with our Patients and Public Assurance group is developing digital inclusion questions that could be shared and standardised for the whole of Wales. And by using that information then to be able to point people in the locality to services that could support them. So again, working with Digital Communities Wales, they have nearly 900 people from public libraries to housing associations and other organisations that we can tap into and see other ways that we can try and encourage people to use the app, but also have the devices available for them to be able to use the app as well. So hopefully that 7% of the population will be able to use the app as well.
Thank you, Joe. Thank you, Matt. I did have a couple of questions, which I'll deal with some other time, just thinking on the basis of time. But if I perhaps just a couple of observations. First on that, as people will know, I mean, the whole issue around inclusivity and ensuring that we don't have an unintended consequence of exclusion is very dear to my heart. And in this and indeed all our programs, if we don't have that at the centre of our thinking and our work, then we will have seriously failed the population of the people of Wales. And I know, and Joe and I have had a number of conversations around this, that it is very central to your thinking and development of the app, and long may that continue. Second is the critical relationship with primary care, because the app will get blamed for things that can't be done on it, where the GP has actually just not turned on the functionality. And that was interesting in one of those bubble comments from the woman with an autistic child, who clearly thought it was the app's issue rather than obviously her GP practice hadn't turned on the functionality. So that is something I think we need to be mindful of, don't we, in terms of managing expectations and explaining expectations to people that might be different in different people from different practices. And third, and a really big takeaway for me, is, this is not here is the app, here's the done deal. This is an ongoing process, isn't it? And we all need to recognize that just as when you turn your phone on in the morning, your apps start revolving and updating, that's exactly what's going to be happening with this, isn't it, over time, based on feedback and more and more sophisticated and extensive operational stuff that can come into it. So it's not going to go away as a program ever, really. So and again, that's a conversation with the public, isn't it, about what expectation will be now and over time. So thank you very much indeed. I think I strongly suspect we could have gone on for another hour discussing this. It's our big first citizen-facing program, and many thanks to you and your teams for all the work you're doing, delivering in what is a very speedy timetable. So thank you, Matt. Thank you, Joe, for joining us, and no doubt we'll be hearing from you again in the future as more and more developments come on stream with the app. Thank you.
Thank you,
Joe. So if we move on now to the next item on the agenda, 4.1, my report. And as now is the practice, I just pick out three things I wanted to just draw your specific attention to in the report. And obviously, if there's anyone got any questions about any of the other issues, or indeed these issues, please do raise them. The first is the digital program governance review update. To give you an update on that, that is now Steve Coombe has delivered his final draft. It's with us and the Welsh Government for comment. And I'm hoping that we're going to be, I think the intention, Chris, is that we ought to be able to present that for the next public board meeting, in terms of putting the review into the public domain, and by then too some idea of where the recommendations or the observations in that report are being taken. So that is moving along. Just to point out, there's an update on our submission to the Health and Social Care and the Public Administration and Public Accounts Committee last year. You will see in my report there's a link to the follow-up information we gave to those committees on the basis of questions that they asked during the hearing and in a subsequent correspondence, which there's also a link to in my report. And no doubt we will now await correspondence from them if they want to pursue any particular issues that they ask for follow-up on. And finally, and a very happy task is to congratulate Marion and Rowan on their reappointment. They've been told, I haven't been told yet, but I'm sure I will be in due course. I think you've both had appointments to March 27, so 4-year appointments. So well done, and we are really pleased about that and look forward to your contribution to the work of the board over the next 4 years. Those are the 3 things that I specifically wanted to draw your attention to. Happy to take any questions on anything else if anyone wants anything further in terms of the issues raised in my report. If not, then we will go on to Helen's report. Item 4.2, Helen, over to you.
Thank you, Chair. Just a couple of things to highlight from me. Firstly, a big welcome to Sam Lloyd, who now completes my executive team. So yeah, big smile on my face for the board meeting today to have the full team in place. And also a big welcome to the Lincoln RISP teams that have transferred over to us at the beginning of this month. So, and some great progress being made there. But also following that transfer, we've also, or the decision for that transfer, we've also been having conversations with the eye care digitisation programme, who are keen that DHCW, that programme also transfers over under kind of our statutory responsibilities. The programme's been with Cardiff and Vale for a number of years now, so we're in discussions with the SRO and Welsh Government around those arrangements. There's a gateway review scheduled for March, so that we understand the current state of the programme and what that would mean in terms of our ability to take it on. So I'll be updating the board further on that in due course. We also had our JET mid-year review on the 7th of December. Positive feedback from Welsh Government colleagues, good discussion. We talked about some of the achievements that we've made in the year and discussed some of the key challenges that we're facing, not least the challenges around long-term sustainable finance and what we need to do. So again, ongoing discussions with Claire and her team and myself and the newly appointed Chief Digital Officer. So Mike Emery came into post earlier this month. We've already had myself and the team a number of conversations, and it's clear that there's a huge desire to work in partnership to drive the digital agenda forward. So a key relationship for us in DHCW and actually for the wider system. And finally, from me, then a huge congratulations to the Welsh Nursing Care Record team. And it's not just DHCW, this is across Wales, a truly kind of national collaborative team approach there. They were awarded the Health and Social Care Judges Award at the recent MediWales event just before Christmas, and Rydia and I had the pleasure of joining them for the award ceremony. So well done to Claire Bevan and all of the team there, really proud of all of the work that they've done and a deserved accolade there. Happy to take any questions, Chair.
Thank you, Helen. Anyone got anything they'd like to raise? No? Okay, thank you very much, Helen. Received that report. And if we then move on to the next section of the agenda, the strategic items, part 5 and 5.1, and the strategic procurement report, and I'll invite Ivan Evans to introduce this item. And of course, we've been joined by Michelle. Good morning, Michelle. Ivan, over to you.
Thank you very much, Chair. As usual, it is a great pleasure for me to introduce Michelle, who's going to be guiding us through this report on purchasing and strategic procurement.
Thanks, Ivan. Just before you start, Michelle, are we going to sort of probably the best stop after each one and then ask for approval?
Yep,
Yep, great, lovely stuff.
Great, thank you, Chair Borodar. So there are 4 contracts in the papers that I'm presenting for the board's approval to award this morning. The first 3, they link together actually. They all relate to the library service. I think colleagues who were here will remember that Jessica Scorer came to the board in November and gave us a really good presentation in terms of the library that we provide across NHS Wales and the benefits of that. So it was I felt quite timely when I was looking at these, that hopefully colleagues can still remember that presentation. So part of that service is we provide online access to e-journals. There are 2 contracts in the set, and that's really because of the way in which we provision those services. So some of those agreements are direct with publishers, and that's the first contract, and some of those are provided to us through agents who in effect act on behalf of the publishers, to 2 separate agreements. So I will take the first one, which is for e-journals that we are contracting with the publishers directly. It provides access to 48 journals. The contract, you'll notice, is for a term of 1 year, and I think this links to the conversation that you had with Jessica in November. There's quite a lot of reviewing, actually, the materials that are provided. So there's a group that have regular reviews, and the specific journals that are being provisioned are subject to those reviews and confirmation that they are still required going forward. So we have a relatively short contract term because that enables us to change the mix should we wish to do so as we move forward into subsequent years. So that's why it's 12 months. The value of that one is about £1.2 million. The procurements, in fact, both of these procurements are procured under a framework agreement. So NICE, the National Institute for Health and Care Excellence, have helpfully put frameworks in place which allow us to call off these resources. And these frameworks are used in England as well to provide similar resources to them. So that gives us a really good framework. It gives us quite robust license terms that they've negotiated with the publishers. So that's our route to market. The contract, we have notified Welsh Government of our intention to enter into this contract as required. The Welsh Government have confirmed that notification, which means that the board is now in a position to make an award decision. And I should say the funding for these services is provided through our core allocation from Welsh Government. So we've confirmed through Claire and her team that we have the funding in place should we wish to execute this agreement. So I'm looking for the approval of the board to award that contract for e-journals.
Okay, and the question I was going to ask was about the annual issue, which you've addressed, Michelle. Any other questions? People happy to approve? Thank you. Next one, Michelle.
Thank you. So the next one, I touched on it a little bit. So this is the agreement that we have for those publications that are made available through agents, basically, and there are two there, EBSCO and Walters Kluwer, who we've been working with as agents to provision services for quite a long time, actually, in Wales. They have a good track record of delivery. Between the two of them, they will be delivering 68 e-journals to across a wide range of users. Again, term of 1 year, same rationale as for the other e-journals. So it allows us to change the mix should we wish to do so. We use the same framework. License terms slightly different because we're operating through agents. So there's a sort of a middleman, if you like, in that position. So it's a slightly different set of terms and conditions, but also under the framework let by NICE. The value of this one, so it's just under £1 million, you'll note that. So we are not required to seek the notification and confirmation to Welsh Government, but we do, in accordance with standing orders, we do provide a summary, if you like, of all of the contracts that we've entered into of this kind of value to Welsh Government so that they're aware that this activity is taking place. So also presenting this agreement today for the approval of the board then to execute.
Thank you, Michelle. Any questions? People happy to approve? Yes, thank you, Michelle. Number 3.
I'm on a roll. So the number 3 is an agreement that we have with the Copyright Licensing Agency. So this is a mandatory requirement for us, really, and that we need to have this license in place to enable, again, a wide range of users across NHS Wales to be able to copy materials. And that's the online materials that we were just talking about in our e-library, and also in the physical libraries. Actually, it allows people. So this is really a legal requirement, and it's a service, again, that we offer for all of the health boards and trusts. There is only one provider who can provide this license to us, so we have to procure it as a single tender. And for that reason, we've actually gone for a longer term, actually, because we anticipate that this will be a continuing requirement moving forward. So we're proposing that this is a 5-year contract. The cost of that is around about 1.6 million. As I said, that's we're acting in our national capacity on this one. This one has been notified to Welsh Government of our intention to enter into a contract. We have not received confirmation of that notification from Welsh Government. I'm not raising this as a problem. I think that's a question of timing. So we anticipate that would be the case, but I am presenting it therefore for the approval of the board, subject to that confirmation from Welsh Government, and we would expect to confirm that to the chair before we took action to execute the agreement.
Thank you. Any questions or comments on this one? I've got lots, but I won't. It's fascinating, this one, isn't it? It's the way that copyright works and how the money's distributed. People happy to approve it? Thank you, Michelle. And then the last one.
Okay, so the fourth contract, slightly different area, this one. So this is in relation to the Microsoft Teams voice capabilities. So again, we awarded an agreement to Microsoft now back in the kind of May time for licenses, which provided access to a range of Microsoft services, one of which is the Teams voice capability. This procurement, therefore, is to enable us to deploy and use some of those licenses in terms of the contact centre specifically. So in Digital Health and Care Wales, we anticipate using this service to support our service desk and our service desk users. So the contract we're proposing is awarded to Softcat. It was procured through a framework procurement. Because of the nature of the requirement, we reached out to our Health Board and Trust colleagues to ask if they wanted to collaborate with us on this. Claire's nodding. I think Claire helped to facilitate that. Actually, it was an offer if others wanted to take this up to work collectively. Two parties you can see in the papers did decide to participate. So the Health Board and the NHS Wales Shared Services, who are actually hosted by Valindra. Their requirement, again, you can see from the paper, is slightly more extensive than ours. They've got a range of services that they are planning to support, including some of their primary care, accounts payable, etc. So it's a slightly wider requirement or benefit for them. So the total value that you will see on the paper is for 1.6 million. That's not our anticipated expenditure. So in the detail, you can see that's the total for all three parties. Our maximum expenditure that we anticipate is around about 500,000. There are some options under that. You can see the options really relate to us being able to call off additional licenses if we wanted to add servers or users from our perspective during the term of the agreement. Our intention to enter into this contract has been notified to Welsh Government, and Welsh Government have confirmed that they understand that we are proposing to do so. So subject to the approval of the board today, we can move forward to award this contract.
Okay, thank you. I've got question or comment from Alistair and David, and they may well be about to ask what I would have asked. So Alistair and then David.
Thank you, Chair. Actually, Michelle, it's not just relating to this one, but those that we've already looked at. It's just for verification that this expenditure and the others are from planned expenditure and within broadly our budgets as set out, and they're not in any way in excess of our planned expenditure, or if they are, that we have adjusted our plans to meet them. It's really just for that confirmation. Thank you.
Michelle, do you pick that up now?
Yep, thanks, Alistair. Really good point. So there's a really brief note in the paper that we put that out, but all of these are within our current budget allocations, so it would have been planned. Claire may want to add to that. Again, she was nodding. So that is my understanding, that these are all in the plan for this year, and they've all been accounted for within our core budget allocation.
Claire, anything you want to add?
No, Michelle's totally correct.
Okay.
They are within budget. Yeah.
Thank you. David.
Thanks, Simon. Thanks, Michelle, for the briefing. Two questions, if I may. So the first one is this capability is going to replace an old Mitel system that we're currently using. Are there any cost savings that we will get as a result of decommissioning that? And is that in addition to, or that you're taking those savings into account in terms of the number you presented?
So that's a very good question. I was looking at Claire. I don't know if Claire's aware of that. So the cost presented in the paper is the cost to execute this contract. So it's not taking account of any savings. You're absolutely right. This is a transition project which allows us to move away from the kind of on-premise Mitel solution to a cloud-based solution. Claire, I don't know if you've got any detail in terms of savings specifically.
Yeah, I don't have the numbers to hand, but there is some benefit from moving to this system, and it's netted off. So the net effect is neutral, but it has been netted off to enable us to afford this. Yes.
Thanks, that's really good. And the second question is, a couple of health boards have taken the option to join us. I don't know the duration of this, but is there an option in the contract if any of the health boards that haven't joined at this point want to join at some point in the near future?
No.
Before you go, Michelle, I'll add my little bit, because that's very much in the sort of the same. Okay. You may or may not be able to do this, but are there interesting reasons why they did and they didn't that might inform how we did things in the future?
Yeah, so two good points. To David's question first, no, this is a specific award for those three parties. And one of the reasons for that will be because we've procured under a framework. So, you know, so if we're using a framework as our procurement vehicle, then we need to be specific about the services that we anticipate calling off. So as I understand it, all of the health boards and trusts were party to the conversations. They all had the opportunity to include their requirements, and those three parties have decided to participate. Again, Simon, I wasn't involved in the process, but that is a good point, and I will follow up on that point about any lessons learned in terms of participation. I anticipate the most likely response on that would be that those were the parties who wanted to proceed with this particular service, and you know, we're at the point where they're able to do that, and also to fund it, obviously. So it was likely a reflection of existing contracts. But I noticed Claire's got a hand up. You were more closely involved. Claire, you may want to comment.
Yeah, so I think timing has got a lot to play in this,
right.
And we did, together with the directors of Digital Peer Group, work to establish who would be interested. I think it's really got to do with the timing around the need, the necessity, certainly for ourselves, but also for shared services to undertake the work that we needed to do, which is why no further other health boards came on board at this point.
So there's potentially an interesting lesson about how you land timings to coincide, if there is potential benefit from going with multiple organizations. Okay, any other questions or comments? No. Happy to approve this contract? Yes, by the looks of it. Thank you very much, and thank you, Michelle, as ever, for presenting the strategic procurement report. And we've moved then on to item 5.2, which is the IMTP 23-26 update, and even ask you to introduce.
Thank you very much, Chair. And thanks to you and Helen and Michelle, because we are ahead of timetable as well. And perhaps this item won't take us up until midday. So just in case there's anything else we can do there. So I would just like to draw your attention to the report itself and focus on section 3 and 4 of the cover paper we have here. Members will be familiar with how we go about our work in terms of developing the IMTP for next year, following the workshop that was held just before Christmas, where all the members were present and contributed to that process. What I'd like to emphasize more than anything is that there is an awful lot of intensive work going on at the current time. You can see the timetable in section 3, there's a timeline there, and also we extract a number of things that we're doing by way of workshops, working with stakeholders and reviewing the plans and things like that. And that's work that's going on across the entire organization. One thing that we're putting particular emphasis on this year is the other financial scenarios. And as you'll see from the report that Claire will give later on in the meeting, the financial situation, and I'm sure you are fully aware of this, the financial situation across the NHS is very, very difficult at the current time. So we are looking very carefully at the resources we have available, the funding that we have to deliver to try to ensure that we have what we need in the plan for the year. And the second thing that I would draw your attention to particularly is that we are trying to adapt our plan so that it aligns more clearly with the priorities of Welsh Government and with the national strategic programmes. And we are doing that at a portfolio level more than anything else. So the IMTP will look familiar in terms of its format in general terms, but it will be easier to read across from the portfolios that we have in our IMTP against the priorities that the Minister has set out to the NHS in its entirety. Because we've got a little bit more time, I would just like to talk about heading 4, which is described as key risks and matters to raise to the attention of the board. They're there for information. They all relate to the financial situation and how we look at our financial situation and the IMTP. I'm not raising them here for the board in order for the board to make any decisions in relation to them. There are many of them, and they are things that relate to the current climate in which we are working, but I'm raising them for information. And to conclude, I just want to give you a flavour of what I think will typify this year's IMTP, which is a little bit different to the previous one. Looking at where the IMTP is going strategically, I think we are pushing more firmly out of hospitals and care in the hospital setting. You've had a presentation on the DSPP app. Sam Hall has been appointed as Director for Primary Community Care and Mental Health Digital Services. They are areas where we are pushing into that area perhaps more determinedly than we have hitherto. So strategically, I think that that's a theme of change that you'll see in the IMTP. And secondly, it's going to be an important year for very many of our main schemes and plans. You will be aware that we've been given new responsibilities by Welsh Government and additional funding through DPIF last year and the year before in terms of COVID. And 2023 is a very important year for the DSPP programme, for the National Data Resource Programme, and for the Digital Medicines Transformation Programme. And there are very many major things for us to deliver on during the course of the year. So it's going to be a really important year, and you will see that coming through the plan. We will be discussing the plan again over the coming weeks, and it'll come back to the public meeting in March for the seal of approval formally. Thank you, Ivan.
I very much hope you don't take us through till midday, otherwise you'll have deprived everyone of the break. which we have from the end of this item up till midday.
I misread, sorry.
Alistair first and then Ruth.
So I'll keep it brief then, Chair. Ivan, thank you for that. It's a very uncertain period, but I just wanted to address in terms of the key risks, the heightened level of security concerns at an international level. Have we reassessed, or did we need to reassess further the risk of cyber attacks from what we now see to be a very significantly developing security problem within Europe, and the potential for that to turn into yet more and very much more aggressive cyber attacks from those who are the sort of parties that we can anticipate. And I just wondered if you could comment on that, Ivan.
Yeah, I'll do that briefly. I'll respond in the language that people are asking questions of me. Sam Lloyd may want to come in. Yes, we're being as vigilant as we can possibly be. You'll recall that we looked at the cyber strategy in our recent meeting. We've also enhanced our cyber protection arrangements through the Microsoft Enterprise contract. So we've dialed up on some of the cyber elements there. And yesterday, and I was going to mention this as we come to the Board Champion report, yesterday we took around 60 people, senior, our gold, silver and bronze, everyone who participates in our gold, silver and bronze, and we had a full day exercise where we looked through a cyber situation scenario, quite reminiscent of the experience in Ireland not long ago, which again has been presented to the board and has been presented to independent members actually across NHS Wales. So we are being as vigilant as we can be, but there's no room at all for any sort of complacency. But you'll see that coming through in the IMTP.
Sammy, by all means, Sam Lloyd, if you want to add anything, please do.
Thank you, Chair. Yeah, just to add briefly that there is a cyber plan that we have developed, and there is the funding case to deliver that, which is coming to the private session later. So we do have a plan for the continued strengthening of our cyber posture. Thank you.
Thank you, Sam. Ruth, and then Rowan.
Thanks, Chair. Thanks, Ivan. I guess I just wanted to explore the point a little bit more around risk and the financial risk, because the financial risk isn't just ours, is it, this year? As the health boards get their settlements, and we identified where we think they're going to be contracting this year and what impact that will have on our delivery ability, because obviously we can't deliver anything in isolation, and if the health boards are reducing resource across things which might help us deliver digital programs, then we have to identify that as a risk. That will be what prevents us from delivering our IMTP.
There's huge risk there, isn't there? Are you going to cover that, even, and then I'll bring Claire in probably?
Yeah, I'm going to bring Claire in if that's okay.
Yeah.
So I'm leading, Ruth, I'm leading the close engagement with the directors of planning peer group to make sure that we're aligned from a planning perspective. I know Claire is working, and the directors of finance peer group is working very, very intensively at the moment. And actually, they met in our offices last Friday. So I'll ask Claire to just respond on that.
Yeah, thank you, and thank you, Ruth. It is one of the hardest financial environments I think we're going to have to embrace over the next 12 months in order for all of us as a system to balance, but also as DHCW to balance. So yes, as you know, we've got many funding streams, one of which is related to the health boards and trusts. So we're working alongside them for them to understand and appreciate those values and where they come from. And I think there's general consensus around that what we've presented is fair and transparent, but it calls into question their affordability in order to meet that obligation. So that's one side of it. The other side is we're part of a system. So as a collective NHS digital ecosystem, we also have to work with the directors of digital peer group to understand how we prioritise the best fit between us on how we allocate and use our resources over this period of time. So there is quite a lot of work that we're doing as a collective, really, to understand the choices that we're going to have to make between now and the end of March in order for us all to deliver a balanced budget. So it is challenging, it is hard, and we're working alongside each other really to make the right decisions and the right choices. And we're working on that. We're not there yet. We're working on that.
No, and if you recall, the part of the government response to our IMTP, this year's IMTP, was to go off and seek resources from health boards to replace non-recurrent resources from the Welsh Government, which makes it doubly more difficult, doesn't it, in terms of the current financial environment. Rowan, I did see your hand up, but it's disappeared. Did you want to come in?
I think we've touched on some of the thoughts I was going to ask about, so I don't need to hear my voice again.
Okay, thank you, Rowan. Ivan, anything you wanted to add in conclusion? You can go until 12. We won't necessarily be here.
No. Having been corrected on the agenda, Simon, I'm more than happy for you to wrap up the item now.
Okay, well, thank you very much for that update, Ivan. And obviously, as you say, in the March meeting, we'll have a longer agenda item where we're considering for sign off the IMTP for 23 to 26. So thank you for that. So now, what time is it? It's now 11:27. So we have a half-hour break until midday. If people could remember to turn their cameras and their microphones off, and we'll rejoin just a few moments before midday. Thank you all very much. If people could turn their cameras on so I know who's back in. I can see you're back with us, Rowan, Claire and Ruth. Okay, sorry, it had defaulted back to a different view, so I could only see 4 of you, but so it looks like everyone is back. Great. So welcome back, everyone, to the next part of the agenda, moving on to part 6 of the agenda. And as people will recall and know, we have a number of board champion roles that are, I think they're actually set out in legislation, the requirements to have them. And some of those are to a greater or lesser extent relevant to the work of and role of DHCW. But what we thought we'd do was we'd bring an annual review of the work and activity of those board champions together in one report, which is what we're taking now. And I'll ask Chris to introduce the item. Thank you, Chris.
Thanks, Chair. Yeah, I'm just pleased to present the first update to the board of our board champion work. I'm just going to quickly run through and give a bit of background around board champions for those that are new to the board. So our standing orders state that the chair will ensure that individual board members are assigned with lead or champion roles as required by Welsh ministers or set out in statutory guidance. So for us, the statutory guidance is via a Welsh Health Circular. The most recent issue was in January 2021 that confirmed a number of rationalised board champion roles. Previously, there was a much longer list of board champion roles. That has been reduced, but it should be noted since that guidance, there was additional request for the role of a board champion for research to be added onto the list. So that has subsequently been included as a non-executive member board champion role. The board champion roles have been in place in health boards and trusts since 2003. It's fair to say that a number of the roles, as you alluded to, Simon, don't relate to DHCW in the same way they do to health boards and trusts, but nonetheless, as an organisation, we have assigned board champion roles throughout the entire list of that identified through the statutory guidance. We are asking today for the board to receive the first update in terms of the work that's been undertaking, so that the report, which is included as Appendix A, covers a summary of the national activity, some of the local work, and then some of the forward planned work in each of the board champion areas. And there's a link to the paper that came to the board in May 2022, agreeing board champion roles and allocation. So I'm asking the board to receive and note the work today, and inviting any board champions who want to highlight anything specifically from the work that has been undertaken, or some of the future work plan that will come back to the board. If they want to come in, happy that they do so now, and then happy to take any questions.
Thank you, Chris. And the way in which the report is set out is really helpful and very clear. I've got Sarah Jane wants to come in. Sarah Jane.
Thank you, Chair. Just to say, we've been quite busy in our area in terms of the equality and diversity arena, violence and aggression, and the veterans. But just to sort of highlight to the board that the equality strategic plan is currently in development. It goes out for consultation today. And a big thanks to Marilyn, actually, as our critical friend in this regard. She's been absolutely fantastic. So I think it's actually broadened our horizons in terms of some of the external engagement that we can do as well, which is really great. So just to say that will be coming to the board in March. So looking forward to presenting that and taking that forward with the commitments underneath it.
Thank you, Sarah Jane. Does anyone else wish to comment or? No. So thank you very much, Chris. We're asked to receive that report, this report, and obviously this will be an annual item that we'll be taking in the future. on the activity and the work of the board champions. Thank you. If we move on then to item 6.2, the integrated organizational performance report, and I'll ask Ivan as Executive Director of Strategy to introduce the item. Over to you, Ivan.
Thank you very much, Chair. This is quite a substantial report. There's a lot of information contained in the integrated organizational performance report, and members will be relatively familiar, I'm sure, with the structure of the document, and I will invite questions from you against the portfolios and the themes that we have contained in the document in a moment. But I'll just introduce from the cover paper a couple of things first. So first of all, the report for this meeting includes the detailed portfolios we have in the IMTP. There are 12 of those. There's a page against each of those, reporting on the delivery and performance against them. We try, as you know, to bring consistency between the IMTP and the IOPR so that we can see a clear framework or a clear skeleton through the activity that we have in terms of what we plan and then how we report against performance. I said in the presentation of the IMTP and the item just before we broke that it was a very busy time for us in terms of planning for the coming year or the coming 3 years. It's also a very busy time in terms of performance at the moment. We are into the final quarter of the year. So just to give you a couple of examples, in December, we did a review of the principal programmes, and there has been some discussion with the Welsh Government about moving priorities from one to another. And resources, I mean by that, finance, and Claire will touch upon that in the finance report that follows. We, over the coming weeks, are doing directorate reviews of all of the directorates we have within the organisation. Helen is chairing that work. And during February, we will be running a review of the portfolios that we have on the programmes, just in order to be sure that the performance is correct as we move into the final 2 months of the year. So there's an awful lot of attention given to that, which goes on behind the report. It's far more regulatory work. So I'll invite questions on the portfolios, and then I will invite colleagues and fellow members in to answer against those as we go. There's a plan on a page. There's one plan on each page. There are 2 measures there that are identified as red. You'll see from the discussion that we had back in October in the autumn, they're not RAG risk ratings. They are identified as red if they have not been delivered against the timeline. So if there are questions on them, I will invite Rydian to come in on the one on information and Sam Hall on WCCIS. And I just want to state one mistake in the document, and that is on the plan on a page, the WCCIS strategic roadmap features as red, but in the portfolio it shows as green. Correct one is red. It's the plan on a page that's correct. It's not been completed yet, and Sam will be able to give some details on that if required. Then if there are any questions on infrastructure and cyber, as we've discussed earlier today, or on the reports on service delivery, then Sam Lloyd will be able to report on that. There's one new measure, which is availability, or where we report there on the total amount of time our services are available across Wales in order to show what the major IT incident information looks like. And perhaps Sam will be able to touch on the major IT incidents. And there are 7 of them included in the report. And again, members will remember that we had a conversation in September, I think it was, as to how our terminology is different to terminology within the NHS. So major IT incident is not the same as major incident in the NHS. They are very different things. And that was one of the things that we discussed in the exercise that we did yesterday in terms of business continuity and cybersecurity. So there are things that have been highlighted in the cover paper: cyber, cancer, digital services for public and patients, WEDS, information governance. But there'll be an opportunity for us to raise those as we go through the report if there are any questions. So I think, Simon, if I can hand back to you to report, and we take us through the report, and then myself and other directors will be able to report against particular sections of the IOPR as we go through it.
Right. So, I mean, essentially, you're asking, has anyone got any particular overarching questions? And then I'll go back to you, Ivan, and then you can just call people in. So, David, you have.
Thanks, Simon. Thanks, Ivan. So in terms of the two items on the plan on the page that are red, I understand what you said about them being red because they weren't delivered within the allotted timescale. Can you just update, or maybe Iridian could update us in terms of the information security? Is that one still outstanding, or has it been delivered? And if it's not been delivered, what's the plan to deliver it? And also on the Welsh Community Care Information System, again, same question. Has it now been completed, or if not, what's the date for target completion?
Did you want to bring Ridian in on the first and Sam Hall on the
Yeah,
second?
so thank you, David. So the first is on is Welsh Government develop and promote a Welsh Government information governance framework. So to an extent, that is in the hands of Welsh Government, although we have an ongoing dialogue with them. I'll ask Ridian as lead for information governance whether there's anything that he's able to update on that first, and then I'll come to Sam on Welsh Community Care Information System.
You're on mute, Ridian.
Thanks, Stephen. A couple of things to say there. Darren Lloyd, who heads up this element of the portfolio that I hold, is working closely with Welsh Government colleagues on a number of strategic outline plans for the governance framework, which is divided into sections, including things such as Welsh Accord for sharing of personal information. The appointment of the CDO is key in this, and of course, as you know, he just arrived in January. I dare say his desk is weighted down with some tricky problems. This is one of them in terms of getting it over the line, and I should be able to have an update with some more definitive timelines once we've had an opportunity to get to work out the detail with him.
Okay, before Sam comes in, I presume, Rowan, you want to pick up on this point?
Yeah, I just wanted to comment that this is a topic that is regularly discussed in the Digital and Governance Safety Committee, and I would reflect that our relationship with Welsh Government and the support of that we're providing is a really good working relationship, and I also think that information governance always has to be right, and it has to be fit for purpose, and it's still a conversation. So information governance is not the same as information security. So I just want to make sure that people are not concerned that there is there is something amiss in that respect.
Good point. Thank you, Rowan. And then you wanted to bring Sam in on WCCIS, yes?
Yes, please.
Hi, Sam.
Hi, thank you. Just to confirm, David, yes, we haven't delivered the long-term roadmap yet. And whilst it's not ideal, I feel that the reasons behind the delay are sound, and it makes sense to do all we can to fully understand what will be required for the future. We were keen to identify what was important for our stakeholders in the longer term. So as part of the strategic review that's been going on now for the past couple of months, we made much more time for stakeholder engagement, as we felt that was incredibly important for those already on the journey with us, but also the other organisations that hadn't joined. And so we spent a lot of time, done a lot of engagement, and having seen some of the early work from the review, it's identified some very clear drivers for us for the future that we will want to work through and refine into our detailed plans. For instance, some of the things coming through are things around interoperability with other systems and clear sets of standards. So really, really helpful things that will help us to understand that roadmap for the future. But just to answer your point around when will we get something? The review is just coming to its end, and so the work to produce the roadmap will be completed by the end of this quarter.
Thank you, Sam. Anyone else before I ask Ivan to? Okay, back to you, Ivan. You'll bring in the individuals then? No, is that what you that was your intention?
Yeah,
Wasn't it?
well, so yes, I was inviting general questions on the 12 portfolios that are in the first half of the report, and then we move into the regular structure.
Yeah.
I wasn't intending to go through each individual slide and to call out somebody to speak to the slides. I was just going to invite, leave it, because everyone's had the opportunity to read the report, and it's a fairly familiar report. So I just wanted to give the opportunity, really. If there's anything that Sam wants to come in on the service and the infrastructure, then you're very welcome to do that. And I've discussed previously with Claire. Claire's finance report follows immediately afterwards. So my suggestion would be that we don't dig into the finance section here. We can do that through Claire's finance report.
Okay, so Sam Lloyd.
Thank you, Chair. Just to ask the board to note a couple of points from the report. From a major incidents perspective, we had 12 over the 2-month reporting period, 5 in November and 7 in December, which is towards the higher end of what we've historically seen. But so we'll keep an eye on that for any trending. But they were all resolved within the SLAs. There's a range of root causes across those major incidents, and we do refer to the incident review and learning group as appropriate to make sure that we pick up any learnings. There were 2 on WPAS which had a common cause, which were related to Citrix, and those have now been resolved. The root cause has been fixed. As Ivan mentioned, we do have a new service availability indicator. The numbers are in the report. I won't go through them, but I think it's important to note there's a graph in there which shows that there were fairly significant improvements in availability made during the previous financial year, and those have been sustained over the course of the current financial year, which is evidence of our ongoing strengthening of resilience and infrastructure. Thank you.
Thank you, Sam. Any comments or questions? And anyone else want to comment on any of the specifics? Helen, and then Rowan.
Chair. And thanks, Ivan and Sam's for the updates. I just wanted to say how pleased I am to see the availability indicator now included within the performance report. I think that's a really helpful measure, and is one that is, it gives us, it's almost the litmus test, isn't it, in terms of wider organisation.